And I suppose we can't really get away from the context that we now face, and this uncertain period in the wake of Brexit, Trump, and this sustained attack really on empiricism, where, as Michael Gove famously said, the end of experts, the public no longer trust experts. So there is this sort of movement really against, if you like, the social policy world, against the social sciences, the role of experts. And I suppose in one sense that is quite understandable, because the experts have got it wrong. We failed to anticipate austerity, we've got the election polls wrong. So there is, in a sense, a mood in the public sphere, just what are experts for, and what are their roles. I would contend, though, that that there is this latent or this intrinsic public support for the role of experts. You only have to look at our any doctor's waiting room, full of patients trusting in the expert view of their physicians. I was on a plane this morning. Nobody was volunteering to fly that plane. We trust in our pilots. We trust in experts. So it's important, I think, for us all involved in social policy that we perhaps stand back and have a fresh look at really what our role is and how we see evidence as a means, as Neil has stated in this quote, in terms of a key foundation really of an informed democracy, how we can invigorate and re-energize debates about what we mean by evidence and research. And I hope you'll be able to join us in this role. In this world of fact-checking and a sustained really assault on the work that we do, I think it is important that we have a hard look really at our roles and how we use evidence. And I suppose the three key themes that I want to try and get across in this short presentation are, first of all, not all evidence is born equal. There are lies, damn lies, statistics. I mean, never before has it been so important to really check the quality and the veracity of evidence. So it's important within, if you like, the evidence ecosystem, terrible term I know, that we have an improved understanding of the quality of research. Secondly, horses for courses. This idea of matching research techniques to key public policy questions. It's all about appropriateness. What is appropriate to you as a practitioner, to your organization with its level of resource and capacity? What is really going to work for our organizations? And finally, I want to touch on and leave you with some sources of locating good evidence. And at the end of today, I'm going to leave you with a publication we produced, which is a guide to the effective use of evidence, which will give you a much thorough set of toolkits and references and follow-ups where you can actually explore the wonderful world of evidence. A quick plug, what we deliver, our main, if you like, signature service is the delivery of masterclasses. We're in a full one-day program. In an interactive format, we actually go through how to systematically use evidence as an effective tool for organizations. That might be something for you to consider. So why do we need evidence? Well, we've already looked at some of the points of this particular sector. But as you can imagine, in this age, particularly of austerity, we have to demonstrate accountability, responsibility, and perhaps something that's often forgotten about, transparency, and how we actually use and demonstrate our evidence sources. It helps to create robust performance management, improve service delivery, particularly the commissioning of services and products. And it also produces effective communications. And I think that's an important point that we're keen to demonstrate, that it's one thing to commission and develop and use evidence in your work, but it's also vitally important you actually communicate that. We live in such a complex communications world now that the traditional routes of dissemination are dead. We now have to be much more strategic in how we actually communicate evidence. what do we actually mean by evidence? Well, I'm quite struck by this quote from medicine. And you've got to remember that medicine really, historically, that's the sector that has really explored and developed these sort of paradigms and evidence. And the key terms are conscientious, explicit, and judicious. That at the end of the day, you have to have a value-based approach to use of evidence, and being conscientious and being explicit in how you use evidence is important. There's also, as we'll see, so much evidence knocking about out there that in this age of information overload, with so many sources available to us, that we sometimes need to be judicious in how we actually use evidence. Now, in terms of evidence-based decision-making, I'm sure you'll know better than I do in your own particular fields that it's a messy, complex business at best at times. And decisions are based often at this intersection of how we use research evidence and how we build in our practitioner experience and judgments, how we inform our work through stakeholder engagement, how we work with our clients. But perhaps most importantly, the prevailing context is so important now, and particularly for politicians, civil servants, and those key, if you like, decision makers. That key political context is vital for us in the social policy field to anticipate and understand. There is a sort of a policy cycle, and sometimes if we really want to affect change and to actually get our work and our evidence and our clients' needs on the political agenda, injecting evidence into that political cycle needs to be very carefully managed and anticipated. Because there's so much research evidence out there, there's so many tools and designs and approaches that can be available. Like, believe it or not, this is just a selection of the variety of particular tools and approaches. And like all sectors, it's beset with different interpretations of terminology, horrible acronyms, academic terms. But in this whole morass of approaches, you'll be very well aware of everything from randomized controlled trials, RTCs, which are often described as the gold standard. But we shouldn't forget those more ethnographic or those more qualitative tools, everything from focus groups to panel surveys. So that's how we judge and use evidence, is vital, and how we match the tool to that approach is so important. One insider, when you actually interrogate politicians and people who grapple with the implementation of policy, this is one particular view, an anonymous view of how they assess and manage the range of evidence that comes across their desk. And not surprisingly, the cabbie's evidence looms high on that agenda. But you'll see the range of stuff that is produced by academics, lobby and pressure groups, the work that political parties do in terms of manifestos, often based on anecdotal political gut instincts. Constituents do have a big impact on how politicians use evidence and bring that into political debates. Urban myths, which are very hard to bury, and how research and expert evidence can jostle with these competing sources of evidence can be quite difficult. And indeed, experts can get it wrong. If you're as old as I am, you'll be aware of Dr. Spock. And this approach, very prominent in the 1960s, where babies were basically placed belly down in their cots as the best means of allowing them to sleep. Now, as far back as the 1970s, there actually was a research base that suggested that this actually led to sudden infant death syndrome, that cot deaths were directly attributable to that particular practice. But it wasn't systematically reviewed. The the research community didn't take up that challenge. And it was really only in the 1990s, following sustained campaigns, that the practice really was properly challenged. But one academic has estimated that 10,000 babies probably died as a result of that 40-year failure, in a sense, to question that particular practice. And it is a sobering point to remember that sometimes life can depend on the judicious use of evidence and how we can bring it into our work. A closer example to home, a more recent one, is the collapse of the Kids Company. And it does, I think it did send a shudder through the community and voluntary sector, really, in terms of the robustness of evaluations. And as the House of Commons Public Admin Constitutional Affairs Committee reported, despite a number of evaluations, reviews, funding reviews, etc., there wasn't a rigorous assessment really of that charity's operations, and that is a sobering thought for us working in the charity sector. So we need to be clear what we want research evidence to do, and it can, on a very basic level, rule out chance. It can rule out bias, particularly cognitive bias, these sort of inbuilt assumptions and tendencies that we have to base evidence on experience, and to stop this process of confounding, where we join two particular incidents and come up with a totally wrong answer. But the best sort of research evidence is only as good as the research that collects it. And when you're confronted with a piece of research, with a case study, with a focus group, paper, whatever, you do, in our view, really need to look behind it. Was the research design appropriate? You need to look at the appendices, look at the footnotes, look at the boring stuff hidden away in the technical appendix to the report. Was the study conducted properly? Maybe having a judgment on the researchers that were involved in the study. Has it been replicated? Has it been scaled up? And if you come out of this workshop with anything, is never trust single studies, and certainly don't trust Wikipedia. In the previous discussion from Janela, there was this approach of a pyramid of levels of evidence, or standards, or like a hierarchy of evidence. And Nesta and organizations such as Project Oracle have come up with this, if you like, series of standards, this a 5-level approach to really how an organization can develop an evidence journey. And to be frank, most of us are really at level 1. And again, I come back to this notion of appropriateness. There's no point trying to pretend that we can all carry out RCTs, that we have the resources to spend 3 years delving into the nitty-gritty, rigorous, controlled trials that we work with. At the end of the day, we have to find tools that meet with our needs. But this, I think, is a useful stepped approach to the sort of approaches that can be built in, that you can aspire to. But one note of warning: some organizations actually are very opposed to this notion of standards of evidence. They believe that it will actually frighten organizations from ever delving their toes into the evidence world. So there is quite a debate really in the evidence sector about this. And our bottom line is, whatever works for you, go for it. But I think, trying to build capacity within your organizations for the effective use of evidence is an organizational challenge that we need to look at. So moving on really to those sources of evidence, like where can we get the support, where can we look for those sort of resources that can help us in this journey. If you go onto our website, you'll come across this picture of sausages all interlinked together in a bright infographic. But it is actually searchable, it is actually interactive. And can I ask, are many of you aware of this growing movement, What Works centers? have you come across this network of largely government-sponsored centres? This has been quite a remarkable movement, and I'm proud to say that Nesta and the Alliance have been involved in helping to stimulate it. But across the UK now, there are 12 What Works centres, some of them attached to government, Wales and Scotland, for example, but others very sector-specific, such as education, local government, policing. But they're fantastic repositories of evidence sources. They specialise in doing systematic reviews, trying to aggregate research studies, in a sense helping us to make sense of what can be a very complicated and very multifaceted world. So it's well worth Googling, a What Works Centre and looking at the range of services. And in terms of your sector, perhaps looking at a What Works Centre for alcohol and drug education work. A recent one has been a What Works Centre focusing on well-being, and that has engendered and attracted a lot of interest, particularly from the third sector. But you'll see just from this infographic the range of sources of evidence, the range of commissioners that are out there, everything from UK government departments to universities, local government, and increasingly charities, third sector organisations, professional bodies. So there really is a growing movement, a growing range of people who are producing and synthesising evidence, which is very heartening to see. Again, on our website, you can actually drill down into these particular sectors. We've probably got about 400 to 500 organisations actually included on this particular webpage. So finally, you'll be glad to hear, I'm going to finish with some plugs to give you a description really of what the Alliance for Useful Evidence does. As we say on the tin, we're an alliance of 3,000 individuals and organisations right across the globe. We've offices in London, Cardiff, Dundee and Belfast, so we're truly UK in scope. And we do a range of services: advocacy, publishing, research, sharing ideas, and holding events such as masterclasses. In short, we're really what we like to think as an alliance of people who are interested and engaged in the effective use of evidence. And I hope you can join with us. We have a free membership facility, and that you can work with us in trying to make the effective use of evidence a key element of our organisations, and indeed as a key foundation of democracy in this part of the world. So thank you.
Thank you, Lisa. That was really, really great and really useful. We've got time for Q&A, so if you have any specific questions for Peter, or any comments, anything you'd like to share with us before we break into tea and coffees. Nothing? No? Okay, well I guess then we can go and have a bit of a tea coffee break. I guess that's the end of our live streaming for today, so thank you very much for joining us. Hopefully that was helpful. And so we can have tea and coffee, and then in the afternoon, well, yeah, after the coffee, we can have a bit of more of an open discussion where hopefully you'll be able to have a bit more of a interactive and have a say in what brings you here, and also what makes evidence for you. So yeah, thank you very much.